All right, in this discussion, we look at specific considerations as it relates to physical activity with female-specific conditions, more specifically looking at the female athlete triad, pregnancy, postpartum, and then menopause and postmenopause. And we're going to talk about those three areas as it regards to the female and kind of their impact and what physical activity could mean as far as benefiting those individual conditions. So we're going to start by looking at the female athlete triad, and essentially when you're looking at this this kind of three-way issue of health problems, you look at a combination and relationship between the menstrual cycle, bone function, and then also looking at eating disorders, disordered eating, and kind of look at the way it's going to cause a myriad of health issues with a female athlete. Again, risk factors for developing the female athlete triad usually include playing a sport that requires body weight to be monitored, social isolation, exercising more than necessary for a sport, pressure to feel the need to win, punitive consequences for weight gain, and then having individuals in their social circle that are very controlling and overbearing. So that could be parents, coaches, and again, any one of the three issues that we're talking about here can cause significant health problems. So, and again, they all kind of affect one another. So, if it, part of the thing to remember about a lot of these conditions is how one could kind of cause the other, and that's essentially why many times these three issues are associated with one another. So continuing on, we're going to look at some early detection signs for the female athlete triad. And again, the individually, like these different signs will be, again, tied to one of the three particular conditions many times. But again, as we know, and as I've kind of talked about on the previous slide, they could all relate to one another. So you look at a history of menstrual irregularities and amenorrhea, history of stress fractures, history of critical comments about eating or weight from a parent, coach, or teammate. So again, that kind of starts to tie in, and we look at the individual's, kind of social circle and kind of how they're impacting this psychologically. History of depression and a history of dieting. And many times, usually what you end up seeing with a lot of this is a lot of, again, a lot of the fad diets. So we're not talking, just obviously eating healthy and having good eating habits. We're talking about many times fad diets that are completely cutting out certain foods or or only eating, certain types of foods and things of that nature. So that would be something that you would be mindful of as well. Some other things, personality factors. So you have individuals who, kind of have this aura that they're looking to be perfectionists. They're very obsessive about things. Pressure to lose weight, frequent weight cycling, early start of sports-specific training, and usually overtraining. So you start to see individuals who are, obsessively exercising and looking to exercise all the time. Recurrent non-healing injuries. And that's one that, kind of goes along with the stress fractures. Again, if, in part of the reason why you look at stress fractures with this is because, again, if in some way the menstrual cycle is being disrupted, that's also going to impact how their bone remodeling occurs. And then plus with the added activity that they're putting on, plus the nutritional factors, that's all going to tie into that. So if they have a lot of these, it would be any type of recurrent or non-healing injuries. Obviously, the stress fracture is part of that, but other things you're going to see with a lot of overuse, even soft tissue injuries, would be coming into play with this. So again, looking at common signs and symptoms, and again, these are some things, I'm reiterating some things I already talked about, some of the early detection sign, obviously, again, the irregular absent menstrual cycles, constantly feeling tired and fatigued, because obviously, typically a lot of these athletes or a lot of these individuals are on very low calorie diets or diets that don't give them sustained energy. So that coupled with the overtraining is going to cause a lot of tiredness and fatigue. You're going to have sleep disorders. Again, the recurrent injuries, there's going to be, self-restricted food consumption, eating less food that's what's needed. The other thing they will complain about or discuss are cold hands and feet. Again, some of that has to do with the metabolic issues that are occurring with a lot of the eating issues and the low energy availability. So after the age of 11 or 12, if they do have low energy availability or energy deficiency, or in other words, they're not consuming enough calories for their activity level, the reproductive system is not going to function the way it should, and that could result in either irregular or less frequent menstrual cycles. So again, there's some terminology here to be familiar with. So irregular or less frequent menstrual cycles is known as oligomenorrhea. If they have 3 or more menstrual cycles missed consecutively, that's considered amenorrhea. Now, you've probably also have heard the term at some point, primary amenorrhea. So primary amenorrhea is when a female has a late onset of their first period or a late onset of their menarche. Once they've had their first period, if they missed 3 or more menstrual cycles, that's also considered amenorrhea. Again, irregular, less frequent menstrual cycles. So in other words, the cycles in between are a little bit longer. That's oligomenorrhea. Now, the issue with that is it's going to cause less estrogen to be produced. So that's going to have an impact on, again, bone health and just, again, their overall metabolic function is going to get disrupted in addition to that with the energy deficiency. So that kind of takes us into the issue with bone mass loss. So again, osteoporosis is a progressive bone disease. We've talked about osteoporosis already. Again, estrogen loss is going to trigger bone loss. And the initial loss in bone mass, again, is known as osteopenia. If more long-term or serious, it could lead to osteoporosis. So what's essentially going to happen is there's going to be an imbalance in the bone remodeling process. So our bones, as we've talked about, are constantly remodeling. So they're breaking down, they're building up. But what's going to happen in the case in dealing with these issues that we're discussing, if there's decreased energy availability, that's going to disrupt the bone remodeling process, and a loss of estrogen eventually leads to brittle bones that are going to be more likely to be damaged, both during activity and later in life as bone loss progresses. Another thing that we tend to see a lot of times is loss of bone mass is also obviously related to deficiencies in consumption of both calcium and vitamin D. So both calcium and vitamin D are both extremely important in maintaining bone health. Now, osteopenia does occur more often in postmenopausal women, which we'll talk about that later on in the discussion about postmenopause. But obviously, that's something that happens, with age. A female athlete triad could happen in very, very young women. And again, that's still going to be caused in that situation by, again, the loss of estrogen. And then as women get older, if they become more sedentary, if they consume too much alcohol, smoking, or prolonged use of glucocorticoids, can also further contribute to losses in bone mass. So now we look at kind of the third area here in looking at eating disorders or disordered eating. So be familiar just with how this kind of comes about and how we kind of define a lot of what we call the spectrum of disordered eating. The Diagnostic and Statistical Manual of Mental Disorders defines feeding and eating disorders. So there's many of these. Probably the two most common that everybody is aware of is anorexia and bulimia. However, there are other feeding and eating disorders, some of which we'll talk about. So again, anorexia nervosa and bulimia nervosa are probably the most common ones that people are aware of. Some other ones that we'll discuss, pica, rumination disorders, avoidant restrictive food intake disorders, and then kind of the other specified feeding and eating disorders. So again, and a lot of this is represented kind of on a continuum. Some individuals will start to show behaviors of one, with being diagnosed with another. So it's important to kind of, again, just early on recognize some of the early signs and symptoms of this to prevent some of the other health issues that could kind of come along with the female athlete triad. So both biological and environmental factors seem to have a role in a cause in developing both feeding and eating disorders. But medical treatments are effective with this and just include changes in diet, psychological treatments, and prescription meds can all treat eating disorders. After about 5 years of treatment, about 70% of individuals with anorexia and 50% of those with bulimia do recover. And again, there's also another disorder which we'll also talk about, which is called binge eating disorder. And about 20 to 60% of those affected do recover from binge eating disorder. So we're going to go through some of these and just kind of talk about some of the differences. And again, some of the early signs and symptoms kind of carry over. So sometimes it might be a little difficult. But in the end, it's going to be the job of obviously somebody else of a medical professional to officially diagnose them with one of these disorders. So if we look at anorexia, so anorexia nervosa is characterized by low body weight, the obsessing about body shape and size, including the desire to be thin, fear of gaining body weight, and restrictive eating behaviors. So some of the signs of anorexia nervosa that an individual could have: brittle hair and nails, dry and yellowish skin. So just some of, again, just structurally, again, our hair, skin, nails requires adequate nutrition. So some of that will start to come about. Constipation, just from the issues with dieting, not getting enough fiber in their diet, muscle wasting and weakness, low blood pressure, sluggishness, reduced body temperature, and all of that's going to make, again, that's where a lot of that, feeling cold is going to come in. There's also a greater risk of heart damage with this. Just because of the metabolic factors, electrolyte imbalances can cause issues with the heart. And again, going as far as it could increase the risk of heart attack and other heart-related problems and death. So the behaviors that one frequently kind of shows, again, using laxatives, forcing oneself to vomit. So typically most people, you'd ask, anorexia versus bulimia. So they commonly associate anorexia with just, not eating enough and just being thin. Bulimia, they talk about what we have called the binge purge cycle. However, individuals with anorexia can also use purging or forcing themselves to vomit as well. So that's kind of one common thing you'll actually see between both of them. Again, exercising excessively and eating small amounts of food. Again, this arises from a complex interaction of various issues: psychological, behavioral, biological, and social variables all kind of come into play in individuals with anorexia. So in looking at the medical treatment for someone with anorexia nervosa, again, it's going to kind of be a couple different things. Obviously, you have the mental health issue, and many times, in addition to the counseling with the mental health professional, antidepressants will also play a significant role here. So make sure that you're aware of your antidepressant medications. And again, obviously reduce, part of the mental health issue will be trying to reduce or eliminate the behaviors and thoughts. So again, there's various psychological techniques that can be used for that. And again, the idea also physically is to restore them to a normal, healthy body weight. Now, looking at bulimia, so we're talking here a little bit about bulimia nervosa. So again, it's a repeated pattern of binge eating, which again, binge eating usually occurring at least one time per week over the past 3 months. And then there's a compensatory behavior. Now, again, everybody, again, classically looks at bulimia with the forced vomiting or purging, which you can also have with anorexia. And just like with anorexia, you also have the other compensatory behaviors, the excessive laxative use, diuretics, fasting, excessive exercise, or any combination of those behaviors. So usually, so many times when people hear that, a lot of these behaviors can kind of cross over from each one, they usually say, well, what's really the difference between the two? One of the differences that you normally see is that an individual with bulimia is typically going to be at a normal body weight typically. So this will be a person who will have these behaviors, but their body weight will kind of stay within a normal range, whereas an individual with anorexia will have an extremely low body weight, relative to their height and age. So that's the biggest distinguishing factor. Some other things that you see in individuals with bulimia, particularly those who do the purging, you'll see they'll complain of a sore throat, swollen glands. They'll have worn tooth enamel from the acidity in the vomit, acid reflux and other GI disturbances. The acid reflux, the weakening of the lower esophageal sphincter with the purging will cause a lot of that. The other GI disturbances from the constant use of laxatives will occur. Dehydration, much like what we talked about with anorexia, they could have possibly experienced heart problems because of the electrolyte imbalances, and that could rise to a fairly significant level as well. And again, from a treatment perspective, you'll have similar to what you'd have with anorexia, with obviously counseling, possibly antidepressants. That would be included in the treatment of bulimia as well. So I had mentioned binge eating disorders. So obviously we talked about the idea of binge eating with bulimia, but binge eating disorders themselves is another kind of feeding issue that could be associated with this. So binge eating disorders have 5 criteria. So eating usually in a discrete period of time, a larger than normal amount of food in a similar time, and a lack of control over eating during that episode. And usually those eating episodes that are associated with 3 or more of the following. So eating faster than normal, eating until uncomfortably satiated, eating large amounts of food when not hungry, eating alone due to embarrassment about the food consumed, or just feeling disgusted with oneself or guilty after eating. So kind of rounding out the criteria for a binge eating disorder, so feelings of significant emotional or psychological distress or anxiety regarding the binge eating. So again, just the feeling guilty of having eaten so much of, whatever foods they are. Again, binge eating disorders that occur at least once a week for 3 months, which is a similar criteria that's associated with bulimia. Now, the difference is when you're looking at kind of the criteria between like a binge eating disorder and a bulimia nervosa, is that with binge eating disorders, or they get classified as having a binge eating disorder, it's not associated with repeated use of a compensatory behavior. So the compensatory behaviors that we talked about with bulimia nervosa, the vomiting, laxative use, and whatnot, that does not occur in individuals that have just a binge eating disorder. Now, the medical treatment regarding binge eating disorder is very similar to bulimia. However, there is a medication that's specifically used to treat this, and this should be noted, lisdexamfetamine, which is a central nervous stimulant, is used specifically for the treatment of binge eating disorders. So that's a medication that is actually approved by the FDA for the treatment of binge eating. So, kind of make note of that as far as your treatments. Again, obviously we had talked about with bulimia, they used, again, typically with bulimia and anorexia, your antidepressants are most commonly prescribed in that situation. So what you end up also having then, again, as I had described previously, you have the other specified feeding or eating disorders, um, include eating or feeding disorders that are not fully meeting the DSM-5 criteria for any of these. So these are going to be situations where the person kind of has some of the behaviors, but they don't exactly fit. So for diagnostic purposes, they get kind of put under this category of the other specified feeding and eating disorders. And there's 5 conditions that are associated with that. There's the atypical anorexia nervosa and atypical bulimia nervosa and binge eating disorder. In the case, for instance, with atypical anorexia nervosa, they have all of those common signs and symptoms except their body weight remains normal. With atypical bulimia nervosa and binge eating disorder, they have those habits, but they occur with less frequency and limited duration. So they don't meet that exact criteria for how often they're doing the compensatory behaviors and or the binge eating. Purging disorder is just the individual has the purging symptoms that are described, again, using the restroom right after eating, frequent use of laxatives, obsessiveness with body weight, signs of the excessive vomiting, swollen cheeks, popped eye, blood vessels, yellow teeth. So they have that, but they don't necessarily have then the other criteria for the other eating disorders. And then there's also something called night eating syndrome, where an individual basically consumes 25% of their caloric intake after dinner. And in addition to that, they also wake up at night in order to eat some of their food. So there you're getting into issues related to, sleep disturbances as well. So those are some of the other conditions that could occur underneath this other specified feeding or eating disorders. Some other eating and feeding issues that an individual could have, or they may even fall under one of the other issues that could occur. Pica is described as having an appetite for non-nutritive substances. So basically an individual is eating things that really is not food, doesn't have any nutrition to it. So like, for instance, eating chalk, paper, and obviously some of the issues that would come about with that are the issues related to the gastrointestinal stress of having these non-nutritive, non-food items entering the gastrointestinal tract. Rumination disorder is characterized by what you'd call effortless regurgitation or vomiting following most meals. And this is actually induced by an involuntary contraction of the abdominal muscles, where there's no retching, nausea, heartburn, odor, abdominal pain associated with the regurgitation. So those are also some things that could come about with individuals with feeding and eating disorders. Avoidant restrictive food intake disorder, which is also known as selective eating disorder, is characterized by the prevention of consuming certain types of foods. And again, usually what you'll see with these individuals is, again, beyond even the significant body weight, is usually some type of nutrient deficiency, because, in all likelihood, if they're not getting a balanced diet of various things, that could cause some type of issues regarding their nutrition. So again, any change in eating is going to be caused by significant weight loss, nutrition deficiency, use of a feeding tube or dietary supplements, or any type of psychological interference. So these are all things that we would want to certainly be aware of with any of these issues regarding the various eating disorders. So in looking at the female athlete triad and just the treatments, again, the medications, it's really going to be based upon what issues are directly affected, what health problems are getting caused. So estrogen, for women with menstrual dysfunction and are at risk for osteoporosis, because this can also help improve their bone mineral density if they kind of restore their normal estrogen levels. I had already mentioned about the inclusion of antidepressants for women who have been diagnosed with an eating disorder. Also, there's the lisdexamfetamine particularly for the binge eating disorder. And again, so no specific medications are necessarily going to be prescribed because they've been diagnosed with female athlete triad per se, but the individual issues that come about can be addressed with the medications. So again, look at the various prescribed medications that are within the conditions within the triad. Again, table 13.1 and table 13.2 will kind of further look at that and just kind of give you some ideas as to the side effects and kind of how the different medications are used in treating the individual issues associated with the triad. So as far as the effects on exercise of the female athlete triad, obviously the biggest issue that's going to come about is that the issue of the caloric balance. So in many of these instances, the individuals are dealing with a deficit as far as energy is concerned. So again, the caloric expenditure that they're getting out of exercise versus their caloric intake, that's going to be the biggest thing that's going to negatively affect their exercise. So just the energy availability not being there, and again, some of the other obvious health issues, for instance, like I had mentioned repeatedly about the heart issues associated with particularly anorexia and bulimia, that could cause negative health effects as well. So we'll talk a little bit about the exercise recommendations. So we're going to talk about, what kind of needs to kind of take place, in order to kind of restore their health and make sure, because obviously part of this is we have to sort of, again, up their caloric intake and start to manage the energy issues associated with this. So energy availability can improve within a matter of days or weeks. So if they start to kind of reestablish and start having a normal, healthy caloric intake, that can improve relatively quickly, and that would cause a return of the normal menstrual status thereafter. Now, if they have had loss of bone mineral, that can take a little bit longer. So recovery of lost bone mineral, normal estrogen levels, that may take up to several years. So that's going to be something that is going to take a little bit longer, which again is all the more important that these things get recognized, early on in the process. Particularly the issues related to bone minerals is going to be something that can possibly take a much longer time. And then returning to the last body weight where normal menses was last observed is kind of a benchmark for normal energy status. So if they go back to a body weight where they were having their normal menstrual cycles, that kind of then tells you that, okay, they're back to normal energy status. Then you could kind of track them then after that. But that kind of gives you an idea that everything's kind of, at least physically for them, starting to return to normal. So as far as the exercise recommendations, again, some of this is going to come about, and again, many times you'll be dealing with individuals, and in this case, that are involved in competitive sports. The exercise professional should look to shift their attention from training and competition to treatment. So you're more concerned at this point about their medical status, and you want to make sure that there's modifications to the exercise prescription to decrease overall energy expenditure. Because remember, you're trying to sort of reestablish that normal healthy balance of caloric intake to energy expenditure. So the training's they're still obviously going to exercise because that's important for other reasons, but what you're going to see typically is going to be a little bit of a decrease or modification related to overall energy expenditure. And it's recommended that the calculated body mass index be increased to over 18.5 kilograms per meter. So again, the body mass index, if you remember, is derived as a body weight to body height ratio. So the normal body mass index is 19 to 24.9. So we're looking to get them within that range. So we're looking to obviously be above over 18.5. And, that kind of then puts them at where they're a normal body weight to height. And in this case, that would give you a pretty good idea because, in many of these individuals, they're not going to have a whole lot of muscle mass to start with. We want them within kind of that normal range. Obviously, again, be aware of what's considered overweight and obese as well. So make sure you're still aware of those value ranges. So you also want to make sure that their increased energy intake is also accompanied by vitamin D and calcium consumption if they're having low bone mass. So again, the vitamin D is going to help with the use of the calcium. So both of those should be combined together. And resistance training is going to help improve their bone mass and muscle strength. So if whatever their eating disorder caused, again, many of them are going to cause low bone mass. They're also going to affect muscle mass, but you want to make sure that you're avoiding any high impact activities. So again, structurally, these individuals are going to be weakened. So it'd be really important to just, watch the activities that you're selecting. There may be, some activities that, as competitive athletes, maybe they were doing that you kind of back off of, for instance, like, the jumping exercises, plyometrics, you probably might step back from those a little bit. Again, just focus on some basic resistance training, general aerobic activity. Again, if you could avoid impact, particularly if they're having issues with stress fractures, that would be something to be mindful of as well. So looking at prevention, so before I kind of outline the 5 strategies for prevention that your book kind of outlines with this, just again to note that obviously creating a healthy attitude towards exercise and food is going to be important. And again, pre-participation screenings are going to be very important to kind of catch a lot of these issues that are involved. With an individual who is, suffering from these conditions, it's important to involve, the appropriate medical professionals, exercise professionals. So your book talks about that team approach, and again, make sure nobody's operating outside of the scope of their practice. So again, the mental health professionals, the person primarily responsible for counseling, doesn't mean that whether it's other non-mental health healthcare professionals can't counsel a little bit and things like that. But again, making sure everybody's doing things within their scope of practice. So again, making sure that it's really important to have an integrated approach because obviously various individuals and professionals kind of that surround the person that has this can certainly all be of benefit here. So the strategies for prevention, keep a written record of monthly menstrual cycle. If changes in the menstrual cycle occur, make sure to encourage females to discuss that. Keep track of daily caloric consumption in order to maintain availability and to maintain body weight. Certainly this is a very healthy habit to have. Tracking your calories, making sure that, and kind of monitoring that with your body weight. Eating at least every 3 to 4 hours with 3 meals a day and 2 small snacks. That certainly provides energy for exercise and recovery from exercise. Those are kind of good basic diet requirements. I know there's various types of intermittent fasting and things like that out there. Not going to say that that they're all necessarily, that anything outside of this is bad per se, but these are kind of good habits that at least people could start with, and as long as they kind of have a good, healthy attitude towards food, then maybe experimenting with some other diets are fine as long as they're maintaining a healthy attitude towards it. Consider snacks as a mini meal and with constituents that are nutritious and healthy. So making sure, again, they're kind of still eating healthy foods kind of in between those meals. And again, keeping a written record of daily exercise, very important as well. So if you kind of look at table 13.1 provides, even some more guidelines related to prevention. And it's broken down looking at diet, looking at body image, the support system, professionals that are associated with this. and then menstrual cycle regulation. So, make sure to take a look at that. That has some good points in it that you could add into your notes as well.